Hello everyone, welcome to Medicare 101, and whether you're turning 65 for the first time or trying to get some more Medicare information, you are in the right place. So let's really do a deep dive into the option one, which would be the Medicare supplement. Which Medicare supplement is going to be best for you? If you're thinking, hey, I want a Medicare supplement, I want to be able to choose any provider I want as long as they take Medicare, I want to have that most comprehensive coverage, the Medicare supplement is going to be the coverage for you. And again, just to go over the major exposures, Part A, you're gonna have that day one deductible for a hospital of $1,700 plus. And then Part B, you're gonna be exposed to $283 deductible. You have coinsurance of 20% with no limit, and then Part B excess charges. Medicare supplements can cover these things up, can make your exposure very minimal. So here is the Medicare supplement chart. This is in your Medicare and your official government handbook. I believe it's around page 75, and it's gonna walk you through the different Medicare supplements available to you. I'm gonna make this very simple here. We're gonna highlight the Plan F, the Plan G, and the Plan N. These are really the only three plans I ever see anybody choose. And if you're on Medicare after 2020, which most of you watching this should be turning 65 for the first time, the Plan F is not available to you, so we would cross that one out. The Plan G is gonna be the most comprehensive option available to you. You can see there's 100% coverage as you work your way down the Plan G column. The only thing that's not covered is the Part B deductible, which is that $283 deductible per year. So once you satisfy your Part B deductible, all other Medicare approved expenses will be taken care of from Medicare and your supplement. The Plan N, almost identical to the Plan G. You have that Part B deductible, but you're responsible for the Part B excess charges as well, which we'll go into a little more detail here shortly. Again, I just want to remind you, even if you have a Medicare supplement, the most possible coverage you can have is 100 days of coverage. After day 100, you are responsible for all costs when it comes to skilled care, nursing home, assisted living, those types of things. We need to make sure that you have a plan in place. What is the cost? That's the next thing I hear, Chase. What is the cost? Plan G, I can give you an average because it's based on your zip code. You're gonna hear us asking for your zip code so we can give you the appropriate price range, but typically it's gonna be $100 to $200 for a Plan G depending on your zip code. Which Medicare supplement is best for me? Well, again, the Plan G, the most simple, the most comprehensive. You have that deductible of $283 per year. The Plan N, approximately $20, maybe $30 cheaper a month, and you're gonna have that same deductible. Now you take on the Part B excess charges with this plan, and again, that's 15%. If a provider is not accepting the Medicare approved assignment, they can charge an excess charge of 15% and leave you with really a minimal expense in that situation. And we very rarely see that happen, if ever. I believe the statistic is over 95% of doctors accept Medicare assignments. So very rare we see that. A lot of people we have in the Plan N, a lot of people in the Plan G. There is no right or wrong answer. It's really more budgetary in terms of how we're gonna go about this. And again, copays, you could have a $20 copay for a doctor visit and $50 for an ER visit if you're not admitted. Best time to enroll in a Medicare supplement. I cannot say enough. If you're watching this and you're turning 65 in the next 6 to 7 months, then this is the time to start taking action, okay? That's when you're gonna get the cheapest rates. Rates never go down, they only go up. You're gonna get the cheapest rates. We're gonna avoid mistakes and we're gonna check it off your list. So even if you found a better rate, which isn't gonna happen, we can always make changes in this next 6 to 7 month window. So I cannot say enough. We can always make changes. It's a lot easier to do it early and change things appropriately if need to, than wait to the last minute. Although we do see people wait to the last minutes too, and we can help no matter what window you fall into. They're standardized plans. So I can't say it enough. A lot of people come to us and they say, for example, we represent a ton of different companies, over 25, I think 30 different companies. And a lot of people have a bias towards one company or another. Maybe it's Blue Cross, maybe it's Cigna, Aetna. We represent all those carriers. And what I can tell you when it comes to a Medicare supplement, it does not matter what carrier you choose. Okay, you can choose whatever carrier you want. All carriers must offer the exact same coverage when it comes to a Medicare supplement. That is not the case with the Medicare Advantage plan, but with the Medicare supplement, the carrier does not matter. The insurance company does not matter. They must offer you the same coverage no matter what. So if you choose a Plan G with one company, it's the exact same as a Plan G with another company. The only difference is the price. List of companies we represent. This list has grown. Here's a general list of the different companies that we work with and broker through and have relationships with. A couple myths I want to tackle. These are just common questions we get. And myth number one, I must have to pay a fee to use a broker and get help with all this. Completely not true. You will not pay anything for our services of any kind. We work for you and not the insurance company. Nobody works for free, so the insurance company must charge a higher price if I go through a broker like you. I can't say enough. We're going to get paid exactly the same price, whether you use our help or you go through this process alone. You're not going to pay a single difference whether you do it on your own or with the help of a broker like ourselves. So we'd love to help you. And I think that the most important thing is the longevity. Been doing this for over a decade. Our practice has decades of experience with our agents and staff. We help you with the changes both this year and next year and years down the road. And that's the biggest thing I've seen being in this industry is plans and coverage change every single year, and having somebody in your corner that knows what they're doing is going to be a massive advantage to you year in and year out. And myth number three, if you get paid by the insurance companies, you must have a bias towards one or the other. Can't say enough. We represent all these different companies and we're gonna get paid by whichever one you choose. And it is our job, our ethical job, to place you in the right coverage for you based on your needs and your doctor's medications and all those individual decisions that you're making. So to wrap it up, truth number one, there's no fees charged. The price you pay is the same, whether you use a broker or not. And with over 25 different companies to choose from, we have no bias. Prescription drug coverage, this conversation is short and sweet in this workshop today because everyone has different prescriptions. And this no one size fits all. Again, Mike and Lenny, my mother and father-in-law, 2 different prescription plans, 2 different sets of medications, and that's how the conversation is going to go with you. So somebody may be watching this and have no prescriptions. Well, it's going to be a very quick conversation on the prescription side. We're going to get you a very inexpensive plan to make sure you have coverage. If you have a bunch of prescriptions, we're going to type all those prescriptions into the computer, and the computer is going to basically tell us which one is best for you based on your prescriptions, the cost, and the pharmacy you're using. And one thing I do want to touch on here, if you don't enroll in a prescription plan when you're first eligible, you could be penalized for every month you forego or go without one. So very important we have this conversation and talk about it, but again, it's a very individualized plan. And here's what our process looks like. We're going to input your drugs into Medicare's online calculator. We're going to choose your specific pharmacy that you prefer to go to. We're going to compare all the plans available based in your zip code, and we're going to enroll you in the plan of your choice. We reevaluate these plans every year during open enrollment, October 15th to December 7th, to make sure that you don't just have the right plan, the right prescription plan for you this year, but you have the right prescription plan for you every year. So as a recap here, again, original Medicare, Medicare Supplement, prescription drug plan, that's going to be the foundation of original Medicare, and make sure you have that comprehensive coverage. Can't say enough. Even with the Medicare supplements, need to make sure we have that umbrella coverage in place. That's going to cover that extended care, your cancer, heart attack, stroke, your critical expenses there, and then dental, making sure if you need dental coverage, you want dental coverage, we have that covered as well. So take a picture of those umbrella packages, take a look at it, make sure you identify which one is going to be the right one for you. Option 2, Medicare Advantage here. So Medicare Advantage, if you're saying, hey Chase, I don't go to the doctor a whole lot, I've liked my group plan, I'm okay with some co-insurance, I'm okay with out-of-pocket, I want those extra benefits that come with this, want to save a little bit. Medicare Advantage is probably a conversation you want to have here. And one thing we need to know about Medicare Advantage is this is a managed care plan. So when I say managed care plan, you are leaving original Medicare, you're leaving the federal government's entitlement, and you're going to a privatized plan. Now the federal government is now paying this managed care plan to manage your care. So you are on this private plan. Now these private plans must include the same basic services of Medicare Part A and B. So you can see right there, must include Part A and B services. And many of these plans include a prescription plan as well. These plans can be as cheap or as low as $0 per month. But we all know, right? You don't get anything for free in this world. And I cannot say enough, It is an absolute necessity with the Medicare Advantage plan to have an umbrella coverage. And the umbrella coverage, we never, ever recommend a Medicare Advantage plan without umbrella coverage. So keep that in mind. Again, you have to pay that Medicare Part B premium, that $202.90. In your coverage, you have copays, deductibles, co-insurance, and out-of-pocket maxims with this plan. We are going to really recommend and look at these plans based on your zip code. So Medicare Advantage plans, they're all based on your zip code. So we're going to look individually at your zip code and see what plans are available first. And then second, we're going to go into your doctors, hospitals, medications, and make sure that we are designing a plan that accepts all those. We want to make sure your plan accepts your doctors, accepts your hospitals, and ultimately has the best price for your medications. We can make sure all three of those are going to be working for you. Extra benefits, if you value these extra benefits, some of them come with gym, dental, vision, over-the-counter benefits. We're going to look at a plan that incorporates all these different things for you. I can't say enough, we have clients all over the country on both Medicare Supplements and Medicare Advantage plans. There's no right or wrong answer. It's really what's right for you. Initial enrollment, when to sign up for these plans. So if you're turning 65, we want to sign up for these plans as early as 3 months before our 65th birthday and really start looking at and making decisions in that 3 to 6 month window. If you're watching this in that 3 to 6 month window, now is time. If you're in that 1 to 3 month window, we still have time, but it's a little more urgent. Okay, so let's make sure we start looking at these plans and understanding what's available to us. Annual election period, so we can change these plans every year from October 15th through December 7th as well. So one more comparison here, and again, there's no right or wrong. There's no one size fits all. We're going to look at your individual needs, your budget, your doctors, your medications, and understand which one's best for you. But Medicare Supplement, again, you're going to pay more for these plans, but they're going to be more comprehensive and leave you with less out-of-pocket exposure and risk. Medicare Advantage, you'll pay less for these plans, but they're going to leave you with more out-of-pocket exposure and risk. Okay, so it's really just what is more important to you and what are you more comfortable with. And again, your umbrella packaging, no matter which option, Medicare Supplement or Medicare Advantage that you choose, we need to identify which umbrella package is going to be the best for you. As we're wrapping things up here, I want to tackle the retirement side. So Medicare and retirement planning, it's what we do. And what I found over the last 10 years is when we work with people in this age bracket, seniors 59, 65 and older, is we saw a lot of this medical transition. We saw people that were entering Medicare for the first time, and with that, they were retiring and had a big financial transition. So naturally, we provided those retirement planning services as well, and want to make sure that you know if you have retirement questions, if you're bringing a 401k, an IRA, some type of employer plan, or you have questions on your current assets, we really provide that holistic approach. And we're going to see and work with all different types of plans. We see 401ks, SEPs, Roths, IRAs, 403bs, 457s, brokerage accounts, mutual funds, you name it, savings, checkings, low interest CDs. I've worked with all those different things. I've seen them all, and understand our team will be able to help guide you and help you transition on that side as well. Now, the types of vehicles that we work with are going to revolve around safe money retirement. We are going to be able to provide guarantees and predictability in your retirement. And that's one of the most important things here, is we want to focus on principal protection, growth, and income. When we have those three pillars in your retirement, that's what a predictable and long-term plan looks like. So that's what we will focus on. And as we wrap this up, I want to go through our three-phased approach. So today, phase number one, we're basically knocking out phase number one. You're getting the Greening Health and Wealth online content, today's educational workshop and seminar, and then you'll get a free copy of 64 Plus. And that's a #1 bestseller that will really take today's presentation in a book format and help you kind of slow it down, maybe circle things and take notes if you need to. And then phase number two, the most important phase, is schedule your free consultation. Make sure that you get your individual questions answered. And we have a ton of incredible people at Greening Health and Wealth that are standing by, ready to answer those questions. We've serviced thousands and thousands of Medicare beneficiaries across the country, and again have that 5-star service and BBB accreditation to prove it and back that up. So would love to talk with you, would love to answer those questions, would love to help you plan for your Medicare and retirement transition. And phase number 3, that's our free lifetime billing and claim service. So we have a great full service team that's going to handle any billing, any claims, any service, and really provide you the holistic support on the insurance side that you're going to need throughout your retirement years. So can't wait to hear from you. Can't wait to answer those questions. And then again, I want to remind you that every year we're going to be there for you. We have our free annual reviews. So every year, October 15th to December 7th, that's going to be another chance to meet and make sure you have the right plan, not just this year, but for years to come.